Hi, I'm Dr. Bill Adams, and this is No Spin Live, everybody's favorite show where you hear about hot topics in plastic surgery from the world's top plastic surgeons. So with us today, we've got Jason Pozner from Boca Raton, Florida. We've got another Floridian, Jason Cooper from Jupiter, Florida. And last but not least, we have Steve Teitelbaum from LA, Los Angeles, California. How you guys doing?
All right.
Great.
We've talked about this before on the show. There's been this kind of host of deaths, and it all seems to be related around one type of procedure in Florida. It's gotten to be pretty serious, and the latest thing is there's been a doctor who had his license temporarily banned because of a number of patient deaths and patient complaints. What is the takeaway? Because I think patients are really looking at this like, what the heck's going on? Is this a bad procedure? What should patients know?
I got to tell you, this is absolutely horrible, and I'm going to wait to have Steve kind of wrap up on this as well, because Steve gave a wonderful presentation about this at the ASAPs or one of the hot topics. So he wrapped up all the different studies with this. I'm waiting to hear from Steve on this. But obviously in Florida, we've been following this topic. Look, this could happen to anybody, but what's happened now is all the societies are behind doing research as to why this is happening, how we can avoid this, and make buttock fat grafting safer for patients. So
Steve Teitelbaum, you immediate past president of ASERF, which is Aesthetic Society Education and Research Foundation. You really spearheaded the study that ASERF just published on this topic, on the deaths from this. I'm sure you can tell us a lot. What say you about this?
Well, the first thing I don't want to forget to say is, this doctor, a lot of people are blaming the deaths on this particular doctor in Florida because he had a troubled record. His license was suspended, then they stayed it while his appeal was going on. And I don't know this particular physician, but I've spoken on the phone with really good doctors, people I know to be good, who trained at good institutions, conscientious people who've had deaths. So this is sort of intrinsic to the way a lot of people have been doing it. We can't just attribute this to bad surgeons. The number of deaths is really scary. It's staggering. It's somewhere between 1 every 6 to 8 weeks the deaths have occurred. We've documented at least 25 deaths in the past 5 years when there were about 100,000 cases done. So the rate is at least 1 in 4,000, probably higher because we know of deaths that we just didn't count. The deaths occur because of fat getting into those big vessels that Jason talked about, the superior and the inferior gluteal vein, which dump right into the internal iliac, and it's a straight shot up to the heart and lungs from there. The bottom line is, after doing about 5 or 6 autopsies, in every case, there was deep intramuscular fat with injury to one of those big veins. No one's ever seen a death where the fat only was located in the subcutaneous tissue. So the ultimate lesson from that is the following. You can't inject deep, which means you can't intend to inject deep, and you need to use instrumentation that really helps you avoid that area.
Look, I don't think it looks good that this particular physician was sort of already sanctioned by the Florida Medical Board. And the board's position was that this physician should not have had his license. Unfortunately, that position was overturned, and in the interim, this death occurred. The physician also had multiple other issues associated with liposuction in 2015. I don't know the physician either, and it's not really for me to say whether or not this physician and his record had any bearing on the outcome in this case. Unfortunately, it just doesn't look very good, and certainly doesn't present very well to other people looking out at us as especially, and at this particular physician, as well as the outcome.
I think that the relevant point is people can do abdominal liposuction, right? And it's parallel to the floor, and it's parallel to the anterior sheath and the posterior sheath and the rectus muscle and the peritoneum, and they can still cause a hollow viscous injury, right? So the point is, you can end up where you are not intended on being, in my opinion. Now, I'm going to give you my opinion and admit I don't do a lot of these. I am not an expert on it. I'm not the one who should ultimately be giving the final word of advice. But in my mind, and from what I know, the smartest thing is to avoid the muscle at all costs and only inject sub-Q. I do know that good people routinely go in the muscle and they do it safely. I know that if you really understand the anatomy and maintain constant control of your cannula tip, you should be able to be fine in the muscle. But I also know that once you go below that muscle fascia, there are no clearly defined planes between superficial, mid, and deep muscle. Like, for instance, there's above anterior sheath and below posterior. There's no planes. Once you go in that muscle, you're playing a whole different game.
I think you guys are great, man. This has been a fun show. It's been really incredible insights. I think the viewers will definitely enjoy it. So if you'd like to see more of this, you can see that on theplasticsurgerychannel.com.